I've started seeing the effect of that particular trauma, the loss of somebody very significant early in life, or even at any point in life, but especially children are vulnerable because they end up cutting short the experience of interaction with that person in their growing up and their formation of their personality. The issue that I think is so crucial is the effect of trauma and stress on development and how it plays out in the rest of life. The current research that's become very, very alive now is how many of the people that grow up with a trauma that is recognizable by other people then become set up to become victims again. And so they may be re-traumatized. We have a lot of factors also in our culture and our society that tends to make death a taboo topic, and so the cultural norm is less said about it, the better. I've seen a number of teens where everybody thought they were dealing with something really well. These kids invariably are recognized by other kids as different for one reason or another. Sometimes it's just the routine of who drops them off at school. Sometimes it's something more pronounced, like being in something that's, say, gender specific, like this Boy Scouts, where a father might play a role and the other boys say, "How come your dad never comes?" If that isn't recognized in part of that family's, I won't say coping, I'd say necessary survival steps. How do you deal with that absence? They may be dealing with it very well, but sometimes it helps just to name it and call attention to it. Or when kids are in a supportive environment like your program has, you really set the tone of honesty and okayness, and no matter what a history is, we cope with it. One thing that we didn't talk a lot about is the delayed reactions. There are, and this is one of the things, I don't like to use what I call scare tactics to get people to avail themselves of services, but I think it's good information for families to have, that even people that go through something seeming to have recovered quite well and dealt with it quite well, there's a wealth of experience coming out of our wars now about people that have delayed reactions that may emerge 10, 15, 20 years later. The only unique thing about it is there seems to be a quality of anniversary or some reminder event that causes them to re-experience that all over, the loss all over. The wonderful ability and opportunity to address those losses and those pains and those things nearer the time of the event actually can be tremendous in terms of prevention by laying the groundwork for problem solving throughout the lifespan.